Welcome to quick guide on clinical test for assessing cervical somatosensory functions. Three components contribute to postural control: somatosensory system, vestibular system, and visual system. Any disturbances in the input between these three components causes cervicogenic dizziness. The muscles which carry afferent information, mainly suboccipital muscles, play an important role in head and neck position. So, if a patient presents with neck pain and dizziness, we can assume the alteration in somatosensory function. Three clinical tests for cervical somatosensory functions are test of relocation error, standing balance test, and eye movement control test. The patient is seated on a chair positioned 90 cm from a wall with pre-calibrated target attached to the wall. A laser is attached to a headband that is mounted on the patient's head. The target is positioned on the wall, the center of which corresponds to the patient's neutral sitting position. Patient closes his eyes, rotates the head fully to the right, then returns as closely as possible to the neutral position. The process is repeated at least 3 times in each direction. The distance of the laser light in the relocated position is measured from the original target position. An error of greater than 7.1 cm indicates impairment. Balance is measured statically and dynamically. Static balance is measured as following: ability to stand in a narrow stance, standing on a firm surface with and without eyes closed and maintaining the position for 30 seconds. Same is repeated for soft surface such as dense form 10 cm thick. Tandem stance, single leg stance on a firm surface again with open and closed eyes. The physiotherapist look for quality of balance, like is there any sway or difficulty maintaining position. Dynamic balance is measured through the dynamic gait index. It consists of 8 different walking tasks, that is, walking on level surfaces, change of speed during walking, head turns in horizontal and vertical directions, walking and turning 180 degrees to stop, stepping over and around obstacles, and walking up and down the stairs. Each item is scored on a scale of 0 to 3, with 3 indicating normal performance and 0 representing severe impairment. A step test, which measures aerobic endurance or cardiovascular fitness. The participants step up and down on a 20-inch step at a rate of 30 steps per minute for a total of 5 minutes. After completing the test, the person's heart rate recovery is measured at specific intervals to assess cardiovascular fitness. Eye movement control is assessed through following ways: watching the patient's eye follow an object such as the physiotherapist's finger through all visual fields while sitting with the head in neutral position. Same is repeated with the trunk rotated at 45 degree. Gaze stability can be assessed through saccadic movements, that is alternating gaze quickly between two targets, and eye-head coordination, a combination of looking to a target followed by moving the head to the same target.